Women are usually the decision makers in the household when it comes to influencing nutrition choices for their children, their partners, and themselves. Now, those choices are even more important during pregnancy. March is National Nutrition Month, and dietitians like those at Carle Health Methodist Hospital work every day to help individuals achieve their best nutrition needs. Joining us with more is Kara Porch, a dietitian with Carle Health. Welcome.
Thank you so much for having me.
Thanks for coming. So what are some of the recommendations to women when it comes to grocery shopping for the family to ensure that they are making sure their family is receiving the proper nutrition?
Yeah, absolutely. I think nowadays everything is marketed as healthy. You look here and there's protein here and fiber there. So I think it's really important to pay attention to that and ultimately setting a goal for your family specifically. Everyone's at a different stage of life, whether you have kids running around or it's just you and your partner at home. I think making sure you have a goal for your specific family, whether that's to eat more protein or just to eat more fruits and vegetables, I think that's ultimately a way to start and see what's healthy for your family specifically. And then reading your nutrition labels, walking through the grocery store, seeing what's actually in the food that you're eating. An easy way to understand how to do that is flip the box over and the first ingredient that's listed is going to be what's most in that product. So if you're looking at granola, for example, you probably want that first ingredient to be whole grain rolled oats instead of like sugar or something like that.
Yeah. Now, as important as it is to make sure that we're eating the right things, real food, as we like to say, that's nutritious, you learned that the healthy foods can be a little bit more expensive. So what advice do you have for budgeting when it comes to these?
Absolutely. I think the number one thing is have a plan going into the grocery store on what you're going to eat for the next week or two. Take a look at your kitchen and in your cabinets and fridge and see, what do I already have? How can I make a meal out of this? And buy as minimal groceries as possible to make a complete meal for my family. So meal prepping and planning would be a big thing, I would say. And also making sure you're doing budget swaps where you can, trying new recipes with maybe plant-based items that are a little bit cheaper. I was just at the grocery store the other day and ground beef was for $10 a pound and you could get a package of tofu for $3 with the same number of servings. So the internet's out there. Find new recipes and new ways to incorporate different foods at a lower budget.
So let's talk about the food preparation now. Why do women seem to struggle more when it comes to choosing the correct food and its impacts on weight loss versus men?
Yeah, I think women have obviously a lot more hormones than men do. Our cycle changes. We have a 28-day cycle, whereas men usually have a 24-hour cycle. So I think keeping that in mind, that your hormones are going to influence what you pick at the grocery store during different times in your cycle. And women also have a different body build. We're built to birth children, so we're naturally going to have a little bit more fat mass than men do. Not saying that we can't build skeletal muscle mass, but just understanding that the food choices that you make are going to be impacted by your hormonal shifts. And that's okay. Everyone has temptations. I'm not going to deny that. That's a common thing. But if you're looking to kind of reduce those or make a change, doing that step by step, one at a time, instead of changing everything at once.
And you know, it seems like one of those things that's easier said than done.
Yes.
And in addition to men and women being different, women are different.
Yes.
So how do we kind of learn about our own personal hormonal changes so that we can apply them to how we eat?
Absolutely. I mean, as we know, perimenopause and menopause happens as you get older, and osteoporosis starts when you're 30. So we have a lot of changes that happen as we age. And I think paying attention to that and understanding that your body is going to change, and it's not because you're eating one specific food that you're gaining weight or losing weight. Your hormones play a really big role in that. So as you age and get into that perimenopause, menopause phase, understanding that you're going to need a lot more fiber to kind of help your gut health, to promote your short chain fatty acid production that reduces as you get older. So eating things like garlic and onions and things like that. And also making sure that you're understanding your body is going to change, and that's okay, and we're not supposed to stay the same throughout our entire life.
Yeah, so in addition to women primarily controlling the food of the household, women oftentimes, they like to host.
Yes.
So how do you make sure that you're preparing things that are healthy without necessarily limiting your guests?
My rule as a dietitian is everything in moderation, including moderation sometimes. There's going to be times when you're going to a party and you want to host people and have a piece of cake and enjoy that, and that's okay. You have to allow yourself to do that. But thinking to make it more health conscious, make sure you maintain your regular eating habits. Don't skip a meal because you're going to go out later. Make sure you're eating protein and fiber and healthy fats to keep you full so you're not overindulging. And if you're going to host people over, maybe make a fun dip to go with your veggies that people haven't had before to encourage those vitamins and mineral intake.
Yeah, encouragement, but still giving options.
Yes, absolutely.
Yeah, because I'm the one that's double looking at that cake and the cookies and all of that stuff. It's just like, I can only have one, so many options.
Yeah.
So for people who want to learn more about their nutrition health, how can they get in contact with the people at Carle?
Talk to your PCP, make sure they understand kind of what you're going through, see if your primary care physician has any ideas, and if he or she recommends you to see someone else, we do have outpatient dietitian services that they can refer you to.
Well, perfect. I definitely appreciate your time. Thanks for coming in and sharing with us.
Thank you so much for having me.
Yeah, we'll be back, Central Illinois, after the break.